Hi, everyone. This is Sean with the MassSupport Network, and here is your COVID-19 update for Tuesday, November 3rd, 2020. So it has been a big week in terms of new cases. Worldwide, we saw 3.5 million new cases in last week, the highest we've ever seen, which was about 300,000 additional cases over what we saw last week. Similarly, here in the US, it was also the most cases ever, with just under 600,000 new cases, about 70,000 more than last week. Here in Massachusetts, we crossed 150,000 cases with about 8,800 new cases, which is itself about 1,500 more cases than we saw previously. So both the world is likely to cross 50 million cases next week, and the US is likely to hit 10 million. So that just show where we are right now. In terms of deaths, things are a little less bleak there, but we are still seeing some trending up. About 47,000 new deaths worldwide, about 6,000 more in the US, both slight upward trends, and about 142 in Massachusetts, which brought us over to 10,000 total. So let's look at how things are doing in a more graphical sense. So here's the overall arc of the pandemic so far, as we've hit new heights in testing and cases. Hospitalizations are steadily moving back up towards our earlier peaks, and deaths have seen a slight uptick as well. So let's look at cases specifically, because we are reaching our record numbers here. Here is the total chart of US deaths over the course of the pandemic. And as you can see with the little labels there on the right side, the last couple of weeks we've jumped what our records are, getting 60,000 cases daily, up to 70,000 a week later, up to 80,000. And this is looking at our averages too, not any individual days. So we have been jumping as fast as we ever have at any point in the pandemic. And to look at where this is happening, especially, let's look at this broken down by cases in regions. So this is where things stood last week in terms of daily cases per million people. As you can see, the Midwest had just reached the highest point of any region in the entire pandemic, passing both the first surge in the Northeast and the second in the South, but was still roughly near those numbers. However, this is how things look right now, and it's just blown by the earlier numbers. These are, of course, cases per million people. The Midwest is not, is the second smallest of these regions, and a lot of the places that are being hit are very rural areas, especially the Dakotas. So that makes this much higher, but still that's going to be very devastating to these smaller communities where a smaller number of people accounts for a greater percent of the population there. Looking at the country as a whole, this is the week when each given state had its highest record single day of cases. And you can see where some have spread out over the course, showing how the pandemic has gone with, for example, a lot of northeastern states off to the left there, Texas and Florida there in the middle. But now, as you can see, most states are hitting their highest points right now, and that is across the country, regardless of which region it is. And it's even so many that this column for the last week of October 25th, it's actually, there are 4 more states in that column that don't fit on the chart. There's 15 states had their highest single day on the week of October 25th. And just one other thing to look at in terms of how states are doing, something I wanted to show here. This is a graph of, on the left, it's states that are having the highest incidence rate in the last 7 days, organized by incidence per population. And on the right is the highest incidence rate ever. And the top 3 states there, North Dakota, South Dakota, and Wisconsin, are the top in both categories. They are the ones who are being hit the hardest in the last week, and also the ones who've been hit hardest for the entire pandemic. Which, as you can see, their case counts are not the highest shown there, but in terms of population, 6,000 over every 100,000 people have been infected in North Dakota. And in these low populous states, it's going to really strain their hospital resources when hospitalizations start catching up to that point. One other thing I wanted to show here quickly, an interesting new chart the COVID Tracking Project put out, shows the percent of cases by day. Obviously, with our 7-day work week, despite people working from home and changes in pandemic work structure, there is still differences in how cases come out, how testing is processed and how it's reported. So you can see Monday, Tuesday, Sunday, those are usually very lighter days comparatively. Obviously, at this point in the pandemic, things are going to be, even a light day is still going to be 70,000 cases or more. But Thursday, Friday, Saturday is when we see our highest numbers. And for example, Friday was the highest day ever, almost crossing 100,000 cases. And as things continue to rise, we should expect to see even more this week. But this is just sort of an interesting thing to see there, and how that's also changed slightly over the course of the pandemic, which is one kind of useful metric to gauge when you're looking at any given day's case counts, how that reflects. So today being Tuesday, we're looking back at Monday's case counts. They are going to be lower than what we'll be seeing later in the week. So let's move on to developments. Obviously, the big one is records breaking, which is a bullet point that I kept on from last week because they keep continuing to break. We had our highest days ever the week before last, and then we had our highest days ever again last week. Also, big news, of course, is Election Day, and that is going to overshadow a lot of pandemic coverage, and going to be adding to a lot of people's stress, and hopefully will not be driving further increases in case counts. Those are going up so far on their own that perhaps election voting will not affect that. Generally speaking, it's believed that in-person voting is about as safe as going to the grocery store. Of course, the longer the lines are, the longer people will be stuck in there, but most of these lines are leaving people outdoors. So COVID spread is less likely. Of course, people will still be suffering any environmental effects if they're out in the cold or inclement weather. Here at home, yesterday, Governor Baker issued a new stay-at-home advisory for Massachusetts, which includes people being home by 10 p.m. With businesses supposed to close at 9:30 to facilitate this. Now, obviously, there are plenty of exceptions there for places that need to stay open. There are essential businesses, people who need to travel for work. This is an attempt to slow spread in the state by preventing sort of after-hours socializing, restaurants, bars, etc. And we'll see how this plays out over the coming weeks. And this is definitely one of those measures that is intended to be a kind of an intermediary step before we go into larger shutdowns. This is bringing us back to, I believe, step 1 of phase 3 of reopening. And if this works, we don't have to close down things like schools for the time being. And finally, the National Academies of Science have published their guidelines for a vaccine rollout, including the order for who to give vaccines to first, with the first phase involving healthcare workers and first responders, followed by the people who are at the highest risk for adverse vaccine outcomes, which includes seniors in shared living facilities. Phase 2 has childcare workers, teachers, et cetera, as well as any at-risk populations for adverse events who aren't in that first tier, and that includes people in prisons. or any other kind of form of detention center. Phase 3 would be children, young adults, and any other essential workers who weren't covered in the previous steps. And then phase 4 is the rest of y'all, the healthy adults who do not have either higher risk due to their work situation or their health conditions. And speaking of vaccines, here's where the vaccine progress stands right now. No movement on the farther right end there, but 2 new projects entered phase 1 today, show that there is going to be a time at some point in the future when we are going to have quite a lot of choices between vaccines. And it may be difficult to know what is the best vaccine to take, but from where we are right now, that sounds like a good problem to have. You can find our stats and trends, the usual sources, COVID tracking, New York Times, and of course, mass.gov. And for more for the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands. We'll be here if you need us. Stay safe.